I have observed that there are a lot of questions concerning the different types of diabetes. A lot of people have been asking me in my DM and also in the comment section, what are the types of diabetes? How do I know the type of diabetes I have? So I have come with the answer. So majorly there are various types of diabetes, but the common ones are type 1 and type 2 diabetes. So I will try in this video to differentiate between type 1 and type 2 for you clearly. So I'm going to use certain characteristics to make it easier for you to understand. First of all, in type 1 diabetes, the main cause of type 1 diabetes is that the pancreas, which is a cell in the body that produces insulin, is totally destroyed. So if the pancreas is totally destroyed, it will not carry out the function of producing insulin. That's what happens in type 1. While in type 2, the pancreas that produces insulin does its work, produce insulin. However, at the point of action, the insulin is unable to act. And that's what is called insulin resistance. The insulin that has been produced is experiencing resistance. So whenever anything is experiencing resistance, it applies more effort, it applies more pressure. But if you're applying effort and pressure, one thing will ultimately happen. You will get tired, you get exhausted. So with time, the cells that produce insulin will get tired of producing that insulin since they are producing insulin, but the effect is not felt and they begin to die. And when they begin to die, you come up with diabetes, and that is type 2 diabetes. So what do I mean? Type 1 diabetes, there's destruction of the beta cells, the cell that produce insulin. Type 2 diabetes, there is resistance, the cell produces insulin. However, at the point of action, the insulin is having a problem, and ultimately the cells get tired and die off. Secondly, type 1 diabetes is commonly seen in children and young adults, those who are less than 30 years. Though it's not exclusive to those who are less than 30 years, but is commonly seen in those who are less than 30 years. While type 2 diabetes is seen in older adults, those who are more than 30 years, though you can see it earlier than that. Like I have seen a patient of 10 years old coming with type 2 diabetes, but it's not common. It's commonly seen in those who are more than 30 years. Then type 1 diabetes is commonly seen in those who are slim build, while type 2 diabetes is seen in those who are obese. Hope you're following the difference. Then type 1 diabetes does not usually have association with family history. Though if one twin has type 1 diabetes, the other twin is at risk of developing type 1 diabetes. But family history is not commonly associated with type 1 diabetes. However, family history is strongly associated with type 2 diabetes. Then in type 1 diabetes, that individual will require insulin for the rest of his life. Why is that? If an individual is not producing any insulin or just producing very small, then his body is not going to function. He will be unable to utilize glucose that he eats in his meal. So he will require insulin. He or she will require insulin for the rest of his or her own life. While in type 2 diabetes depends on the stage. There's a stage in which we suggest that you just focus on diet and exercise and you'll be fine. There's a stage in which we'll give you medication. There's a stage in which medications may not be good enough. We have to give you insulin. So for type 2, depends on the stage you find yourself. So if you want to find out the type of diabetes, give me a DM and I'll see what I can do, because it is very important to know the type of diabetes you have, because that will determine the kind of treatment you will receive.